Hello, everyone. My name is Abdul, and along with Kamari, Eddie, and Daniel, today we'll be presenting about our hot topic on urban health. In an overview of our table of contents, I will start off with addressing the importance of urban health and why is it a hot topic. Then Kamari will guide us through the variability of the problem across the World Bank regions. Next, Eddie will take us through the global framework and action. Then Daniel will critique the global health systems. Afterward, I will address the recommended priority areas of action. So, why urban health is so important and why is it a hot topic? The World Health Organization reported that over 55% of the world population currently resides in urban areas, and that is expected to increase to 68% by 2050. The International Society of Urban Health validates the rapid increase in urbanization across the globe, but particularly most prevalent in low-income countries. In addition to the rapid urbanization, the increase of disease risk, incidence, and prevalence within urban communities of communicable and non-communicable diseases. COVID-19, HIV/AIDS, tuberculosis, pneumonia, and diarrhea are just some examples of infectious and communicable diseases, while non-communicable diseases such as heart disease, respiratory illness, obesity, cancer, diabetes, and mental health illnesses. The World Economic Forum discusses how public domains with higher population density are more likely to suffer from mental health disorders. The following video is a production by the NYU GPH. We'll be overviewing urban health.
Urbanization is one of the most important demographic shifts worldwide. Over the past century, there has been a significant change in the way that the majority of the world's population lives. And by 2050, over 68% of the world's population will live in cities. Cities are full of opportunity, but they come with challenges. Urban populations have some of the world's most prominent health disparities. Some of the factors that impact urban health are things like natural and built environment, social and economic development, food security, air pollution, overcrowding, and even politics. Cities face increased threats of health challenges, such as infectious disease like HIV/AIDS, HCV, tuberculosis, pneumonia, and measles, non-communicable diseases like heart disease, asthma, and diabetes, and threats from city life like traffic injuries and violence. In cities, there are also typically more dramatic differences in health between communities, meaning that one neighborhood might have amazing health and the one right next to it might be suffering. This is because of the inequities from residential segregation. Each neighborhood comes with its own urban environment. Urban environments have high population density and have different influences ranging from education availability and quality, socioeconomics, as well as biological and environmental factors. These influences are very different in an urban setting than they are in suburban or rural environments. Many times, these influences have a greater impact on urban populations. Urban health is the field of public health that works to break down and figure out how these factors work together to affect the health outcomes of large populations. The complexities of this field include understanding urban systems, disease transmission, and impact of factors like air quality, overcrowding, access to nature, sanitation, access to education and healthcare, and so much more. Urban health practitioners work to uncover the causes of urban health problems, evaluate policies, and develop innovative solutions to improve the quality of life and health outcomes for urbanites. Here at NYU GPH, we are actively researching these impacts on city dwellers. Being located in the heart of the most populated city in the United States, we thrive in this field. We teach our students how to break down these complex issues and train them to understand how all these pieces work together. We build partnerships between cities and within our local communities, and we train our students to be tomorrow's urban health leaders.
Now moving on to the challenges within urban health. Population migration to urban environment imposes a burden on existing health systems to improve and provide services for the rising population size. Urban environment can still present major challenges on the healthcare infrastructure, yet there are opportunities to improve health, environmental, and climate actions. Urban environments are characterized by high density, diversity, complexity, and inequity. The World Health Organization encourages action on the local scale, such as strategic urban planning to cultivate better health systems and policy decisions. Now, moving on to policies. The Sustainable Development Goals, the SDG 3 and SDG 11 goals, focuses mainly on the well-being and the sustainability of cities, respectively. Health on all policies is a systematic approach focuses on improving urban policies through addressing decision implications and synergies. The Barcelona Institute of Global Health renders scientific evidence into policy and practice by applying tools such as health impacts assessment. In all policies can be implemented, inform, and improve to transport and urban planning to achieve the 2030 SDG agendas. Moving on to recent events. Recent events such as COVID-19 pandemic have put urban health systems across the globe to the test in addressing and containing outbreaks, particularly in highly populated cities. Urban health cities networks supported that cities act as centers of community transmission, as well as entry points into further countrywide transmission through national and international travel and trade. Empowering local governance define how we shape our public health responses in the community. Now, Kumari will guide us through the variability of the problem across the World Bank regions.
My name is Kumari, and I'm going to discuss the variability of urban health issues across regions. I'll begin by discussing urbanization and global trends. Currently, more than half of the population of the world resides in urban areas, and these numbers are estimated to increase to over 68% by 2050. Rapid migration to cities highlights conditions in which many disparities are exacerbated, particularly in lower middle-income countries. Fundamental demographic shifts alter the lives of millions and produce new challenges for humanitarian efforts in responding to crisis in urban settings. Furthermore, significant overpopulation impacts the already challenged infrastructure for these cities. They're not equipped to handle the influx nor needs of such high-density populations. The image on the left shows different types of urbanization and further illustrates the disparities between wealthier and poorer nations. The graph on the right illustrates the anticipated rapid growth rates in megacities, large cities, mid-sized cities, and regional cities from 1990 to 2030. The Council on Foreign Relations states that much of the population growth that has produced large, poor cities is natural. Cities like Cairo, Delhi, Karachi, and Lagos have grown chiefly because their residents are living longer, and fewer of their children are dying, rather than because people migrate to those cities for jobs. Making cities more compact but neglecting the importance of good infrastructure may increase the negative impact of higher residential density on health. According to a Lancet research study, human population density and growth are significant predictors of historical emerging infectious disease events, and thus urbanization is likely to have a profound effect on public health as rural pathogens adapt to urban conditions, and other pathogens emerge or reemerge in urban areas. We've seen this displayed with COVID-19. The picture on the right is from the United Nations and shows statistics regarding urbanization indicating that our future is urban. From only 751 million in 1950, the population of the world's cities has rocketed to 4.2 billion. The UN Department of Economic and Social Affairs notes that future increases in the size of the world's urban population are expected to be highly concentrated in just a few countries. Together, India, China, and Nigeria will account for 35% of the projected growth of the world's urban population between 2018 and 2050. By 2050, it is projected that India will have added 416 million urban dwellers, China 255 million, and Nigeria 189 million. The DRC, Pakistan, Indonesia, the US, and Bangladesh are also quickly urbanizing and will impact urban growth. The graphs provided represent rapid urban growth by region, demonstrating that the majority of urbanization will impact developing countries most. And the quote I've selected is a quote from the European Environment Agency regarding Africa, stating, Africa presently has 400 million urban inhabitants, 11% of the world's urban population. But by 2050, this is expected to rise to 2 billion, 32%, with most of the growth happening in slums. Health challenges in urban environments relate to noise and air pollution, lack of green spaces, inadequate transport, and reduced opportunities for physical activity. Additional predictors of disease are inadequate governance, overpopulation and overcrowding, traffic congestion and accidents, and climate change, which influences environmental factors in urban areas, like air pollution. Cities consume 78% of the world's energy and produce more than 60% of greenhouse gas emissions, yet they account for less than 2% of the Earth's surface, according to the United Nations. There are significant drivers and determinants of health and disease in urban areas. Human factors such as population density, migration, trade, sanitation, and access to clean water can promote the transmission of pathogens and alter vector dynamics, while social factors that drive health inequality all influence the epidemiology of infectious disease in urban areas. Some of these factors are socioeconomic status, housing, race, ethnicity, gender, sexual orientation, education, disability, homelessness, just to name a few. Most urban people live in slums that are unregulated, have congested conditions, are overcrowded, are positioned near sewers, and restricted to geographically dangerous areas such as hillsides, riverbanks, and water basins subject to landslides, flooding, or industrial hazards. 4.2 billion people living in cities, half of humanity, suffer from inadequate housing and transport, poor sanitation and waste management, air quality, failing WHO guidelines. Health outcomes are determined in urban areas based on geographic location as well. In higher income nations, the primary causes of death are non-communicable diseases, such as heart disease, cancer, and diabetes. These diseases are often the result of obesity, malnutrition, and a lack of exercise. A lack of green spaces contributes to increased mental health issues for city dwellers as well. Large metropolitan areas face high infant and child mortality rates, serious air and noise pollution, high crime rate, large income disparities, and an increasing flow of migrants that exacerbate unemployment. Other major health problems resulting from urbanization include poor nutrition, pollution-related health conditions, communicable diseases, poor sanitation and housing conditions, and related health conditions. These conditions lead to an upsurge in contact-related diseases such as measles, tuberculosis, and diarrhea, typical of crowded environments. Physical injuries due to violence, traffic accidents, and industrial accidents also persist. For cities in developing countries, the epidemiological effects of these factors are often concentrated in informal settlements, where population growth and density are highest, making conditions perfect for the transmission of communicable diseases. Now Eddie will discuss the global framework and actions designed to address the issues I've presented.
Hello, everyone. This is Eddie Plata, and I will be going over the most notable organization that is responsible for action to address the problem of urban health, and that is UN Habitat. The UN Habitat's vision of a better quality of life for all in an urbanizing world is bold and ambitious. They work with various partners to build inclusive, safe, resilient, and sustainable cities and communities. They provide urbanization as a positive transformative force for communities and individuals. They aim to reduce discrimination, inequality, and poverty. And here's a bit of their history. On January 1, 1975, the UN General Assembly established the United Nations Habitat and Human Settlements Foundation, which was the first official UN group dedicated to urbanization. With only $4 million spread over 4 years, it was intended to support national programs regarding human settlements through the provision of capital and technical assistance, specifically in developing countries. In 1975, urbanization and its impacts were not at the top of the UN agenda. This is because 2/3 of humanity was still rural. The first international UN conference, Habitat 1, recognized the challenges of urbanization, and it was held in Vancouver in 1976. This was a precursor of UN Habitat. As you can imagine, the limited funding and support from politicians, Habitat struggled for nearly 20 years. Up through the 90s, there was a massive amount of urban growth, particularly in developing countries. In 1996, the second conference, now Habitat 2, was in Istanbul, Turkey, to assess 2 decades of progress since Habitat 1, and it was to set fresh goals for this new phase. It took almost 20 years for the adoption of the Habitat Agenda, and it contained over 100 commitments and 600 recommendations. From then on through the early 2000s, there was a major refresh in the agency. And on January 1, 2002, the Habitat mandate was strengthened and its status elevated to a fully recognized program in the UN system, getting its now named UN Habitat. The goal of UN Habitat. In 2015, member states approved the Sustainable Development Goals, which included a dedicated goal for urban development, SDG 11, which was to make cities and human settlements inclusive, safe, resilient, and sustainable. A year after the next UN conference on housing and sustainable urban development, which was now Habitat 3, member states signed the new urban agenda. This is a living action oriented document which sets gold standards of achieving SDG 11. This framework helps cities reimagine the way cities are built, managed, and how habitants live. Quoting from the General Assembly's resolution, accountability is the obligation of the Secretariat and its staff members to be answerable for all decisions made and actions taken by them, and to be responsible for honoring their commitments without qualification or exception. This accountability framework was intended to foster a culture of accountability across the UN Habitat team. And to learn more about their ethics and to read their accountability reports, I definitely recommend you visit their website. One of several UN Habitat's projects included advocacy through themed days like World Cities Day and World Habitat Day, and fostering collective leadership through hubs like Urban Thinkers campuses that harnesses the role of city and community leaders in urban planning and design. From the 2023 UN Habitat Strategic Plan, which I have here, it's a lot. We can see a high-level logic model on the projects of UN Habitat, which are urban planning, governance, policy, and legislation, financing mechanisms through a social inclusion lens of human rights, gender, children, youth, older persons, disability, as well as the theme of resilience and safety. Some challenges that we are seeing in a rapidly urbanizing world include investment in less developed regions. Approximately 90% of the growth will occur in these regions. These include East Asia, South Asia, and Sub-Saharan Africa. The rapid speed will not translate to thoughtful growth, as many of these places are constrained with capacity and resources. Urbanization in these areas are not planned nor prioritized, so in turn what happens is the growth of slum-like settlements. And another challenge is poverty, which has declined, but the gap between rich and poor is at an all-time high. This level of inequality does not help the urbanization process. Climate change, migration, and even gender-based discrimination are all impacting urbanization. Some successes that we have seen more recently is UN Habitat's response to COVID-19. They have provided 32 million of funding to a portfolio of over 75 projects in 37 countries and 300 cities, providing health response, humanitarian response, and socioeconomic response to over 10 million people. They have also set a global discourse on sustainable urban development using 77 indicators with the global urban indicators database from 1,500 urban areas in 132 countries. With the global urban indicators database, they have created a global monitoring framework and forged new relationships. The final thing I would love to show you is a video of from UN Habitat, more specifically on the World Cities Report.
Now, we've established that urban health is a significant hot topic in public health, and also that there are targets that we're working towards implementing and solutions to addressing these urban health issues globally. However, as you know, urban health problems still run rampant across the world, and these targets have not yet been met. So I'd like to spend a few moments discussing what is it that is standing between the successful implementation of these urban health problems and solutions, so that we can further understand how can we attempt to improve these solutions so that we can have a stronger urban health environment. I'd like to bring everyone's attention to Sustainable Development Goal 11 on sustainable cities and communities. This SDG contains 15 indicators and 10 targets. As you know, these indicators and targets are a way that a country can report on metrics for how they are doing in achieving a sustainable development goal, in understanding what their urban health environment, for example, looks like, and in understanding how well are we achieving our targets. So I'd like to give some examples of indicators. So one indicator is the proportion of urban populations living in slums, informal settlements, or inadequate housing. Another example is the number of deaths, missing persons, and directly affected persons attributed to disasters per 100,000 population. Some examples of targets are to, by 2030, ensure that access for all to adequate, safe, and affordable housing and basic services, as well as upgrading slums. Another target is to strengthen efforts to protect and safeguard the world's cultural and natural heritage. Now we'll discuss towards the end, we'll discuss in a minute exactly how well are we doing on these targets and indicators. And we're noticing that we see very poor reporting of these indicators and targets. Now, the reporting is voluntary, and countries are doing a really poor job of covering all the indicators and targets. In fact, the average country is only able to report on under 1/3 of the global indicators, and only 3% on report on more than 5 indicators. For targets, only 31% of countries report on even a single target. Now, we are clearly lacking in data. How can we appropriately address this problem if we don't even know how countries are doing? We are more or less working in the dark here. Without appropriate voluntary reporting from countries, we're not going to be able to address this urban health problem. In a few slides, we'll discuss some solutions to this issue, but it is much more pervasive and widespread than it may seem. I'll move forward to another issue that we are seeing in implementing solutions in urban health, namely the lack of health infrastructure. Now, I'll give an example that we may be familiar with. In the first wave of COVID-19, India had begun some capacity building in improving their capacity for ill populations. However, when the second wave came, they dismantled that infrastructure, for example, inline oxygen in hospitals. This is a clear example of a preference over short-term gain rather than long-term security in health infrastructure. Without a strong foundation health infrastructure, we won't be able to address our urban health problems, and we won't be able to implement our goals. So lessons must be taken from these prior experiences to have a stable foundation in health infrastructure to be able to implement our solutions. So to address these issues, like I said, we must scale up capacity building initiatives, but remain stable in the scaling of those initiatives. A focus on investment in the future rather than just the immediate present. In terms of reporting, there's an urgent need to harmonize both international and intranational reporting systems. So on the intranational level, we need effective administration oversight on the national level governments between the data synthesizers and data producers. So you have a national level government which synthesizes data, and local level government which can produce the data. And we need effective administration, communication, harmonization between these two levels. And on a greater level, on the international scale, we need accountability in voluntary national reporting. This stepwise level of accountability and administration oversight from the international level to the national level to the local government level is one way for us to be able to address this issue.
Moving on to urban health priorities, the first priority we have is the implementation of government legislation and policies aimed at improving transportation and the reduction of greenhouse gas emissions. The second priority is empowering public health departments to address urbanization, specifically with regards to funding and infrastructure. The third priority is to increase the coordination among national data synthesizers and local data producers for measuring progress in urban environment. If you have any questions, please feel free to comment on the discussion board and leave a comment, leave a question. We look forward to hearing from you. Thank you.